So occupational therapy students do a mixture of in-classroom as well as out-of-classroom learning. So the in-classroom learning involves lectures, typical style lecturing, as well as practical tests and practical learning, hands-on learning, and then you take that knowledge into the field working alongside a practicing therapist to then put those skills to the real-world test. And you do a mixture of that throughout your 2 years of school until you graduate and take an examination to then fully practice.
So I love being an occupational therapist. I chose occupational therapy because it's such a fulfilling and rewarding career where you're helping to improve the lives of others. I felt inspired to pursue this career because I found that occupational therapy treats people as a whole, and it addresses the vital importance of their psychological and emotional well-being as well as their physical needs.
So the Masters of Occupational Therapy program here at the U of M really helps with that real-world experience because we have a really close connection with the therapists that work in the community, not just here in the school. So we get a lot of that relationship building and then a lot of practical opportunities to actually put our knowledge to the test and run through real case scenarios that our profs and teachers have put together for us based on their experiences. Well, we are kind of a small class, only 50 students, so you get to know not only your fellow colleagues, your students, but you also get to know your profs, and you have an assigned advisor who then checks in with you throughout your schooling. And they then help you along, help troubleshoot, and any other professors too or teachers, instructors that you have also are really approachable, and they think of you as a junior colleague, like a future colleague, and so they give you that relationship, not such a power dynamic of teacher and student. They really have you on the same level, so that really helps in fostering the relationship, feeling like you're already an occupational therapist ready to then go out into the field.
As I was completing my Bachelor's of Arts in Psychology, and I learned about occupational therapy, and it met my requirements of what I wanted to do in life and help people in the healthcare. I took the leap of faith and I just applied, and I never looked back again. I loved being in the program. It was just such an incredible experience. The patients and clients that we see can range from infants, children, adolescents, all the way through older adults and the elderly. We are there to help people learn how to recover and heal and live life on their terms. We work in hospital settings, in the community, private clinics, we work in schools as well as long-term care homes. There are many opportunities in giving back to the community and just making that lasting and meaningful difference to someone's life.